Good evening, everyone. My name is April Gossman, and I'm a nursing student with Oklahoma Christian University. And today I want to talk to you a little bit about nurse to patient ratio. Nurse to patient ratio is a serious issue, and it doesn't just affect current nurses, it affects nursing students, and also it affects the patients. More importantly, it affects the patients. So thank you for your time, and I will begin my presentation. Hi everyone, my name is April, and what we're going to talk a little bit today about is nurse to patient ratio. As a student nurse, I have learned a lot about patient care, pathophysiology, medications, and how to think critically in high pressure situations. But one of the biggest lessons that I've learned outside of the textbooks is just how important nurse to patient ratios are. When I first started doing clinicals as an RN nursing student, I thought, well, being a good RN must be knowing everything and doing everything perfect. Wrong. The truth is, even the best nurse can only do so much when they're overwhelmed. I have seen nurses sometimes caring for 5, 6, even 7 patients at once. They were running nonstop, barely getting a break, constantly pulled in many, many directions. And I saw what that did, not just to those nurses, but to the patients. Delayed medications, missed assessments, families waiting on answers, and nurses going home feeling like they didn't do enough. They were just flat out defeated. Safe nurse to patient ratios are not just a policy issue, they're a patient safety issue. And I'm sure you're wondering how it's a patient safety issue. It's also a mental health issue for us future nurses. Because how can we truly care for others when we're constantly burnt out, rushed, and worried about missing something critical? As a student nurse, we're not just beginning our journey. We're already being asked to step into a healthcare system that desperately needs change. We can't stay silent about this condition. We see and experience, we have a voice. Even now, we can use that voice to advocate for safe staffing, for the future, for our coworkers, and more importantly, for our patients. That is what we're here for. We are here to be a voice for the voiceless. Because every patient